All right, good evening, everyone. Thank you for coming. We understand you guys have a busy schedule. We really appreciate it. I'm Sam. This is my colleague Manny. Today, we're going to be talking to you guys about the role of a physical therapist in regards to health promotion for patients with multiple sclerosis. So, the table of contents for this presentation is going to be multiple sclerosis. What is it? We're going to talk about lassitude, not latitude. We're going to talk about how a physical therapist can help you guys with multiple sclerosis. Does exercise actually help multiple sclerosis or MS? What should my diet consist of? What should I be eating? Is it a flare up or is it? I'm really stressed out. What can we do about that? So, we're going to dive into multiple sclerosis, a little bit of background information. Relapsing remitting is the most common type. There are four types of MS. 900,000 Americans have been diagnosed with MS. And these are recent findings by the National MS Society. Some of the common symptoms of MS are going to be numbness, tingling. It could be in the legs, could be in the hands, could be in the arms. We have also fatigue, which is very common, muscle spasms, weakness, dizziness, problems with vision, and pain. So, what makes lassitude different from regular fatigue? Well, lassitude is a common symptom reported by those with who have MS, and they're different things. So, lassitude is fatigue that's not correlated with a person's activity level. So, lassitude can be more severe, and it can happen every single day. Specifically in the morning, or even after sleeping the entire night, you might still wake up very fatigued in the morning. It could get worse throughout the day, come on suddenly, get worse with certain temperatures that are like very hot or humid, and this can affect us, our daily lives, daily activities, and it can affect our mental health as well. So it's one thing to feel fatigue because you went to the gym and you exercised, but it's another thing to feel lassitude, which is where it's not correlated to how much activity you've done. So I'm sure you've all experienced something similar to that.
So, how can physical therapy help? So, physical therapy plays a crucial role in all stages of MS, from the least severe to the most severe. There is a role for physical therapy throughout each stage, and physical therapists can help by specialized screening methods to identify your specific dysfunctions. Each stage is marked by specialized deficits that might develop over time. Uh, they will utilize various outcome measures to track the progression or regression of your current condition. So this is a big factor in seeing how well you're doing in various aspects of your deficit or functional deficits and in life as well. Working together, you and your therapist can develop a combined exercise regimen to improve your functional capacity and independence. And like I said before, each stage of MS, each person is highly variable. So a one size fits all approach to treating these patients or treating you guys isn't going to work out too well in the end. It has to be very tailored to your specific needs. And finally, if needed, a therapist can offer specialized assistive equipment to help improve your functional capacity. So that could be wheelchairs, rails, any kind of equipment that can help your daily activities. So we're going to talk about more about what exercise can do for you. So we broke it down to three things. You can actually add in breathing too, because breathing is a big functional component of this issue. But for the sake of time, we're going to talk about resistance, aerobic, and balance training. So resistance training, progressive resistance training, has shown to improve gait parameters such as speed, hip, knee, foot, and ankle range of motion, and overall capacity to walk independently. And as we see in a lot of patients, as the disease or condition progresses, walking becomes a major factor in how we can function throughout our daily life. Aerobic training and resistance training go hand in hand. Again, aerobic training at low levels, aerobic training in MS has been shown to elicit improvements not only in the quality of life but also coordinated function and physical fitness. So again, we're talking about just developing that coordination, that capacity to walk or perform daily activities or functional activities. Balance training is another one that we want to dive into to kind of help us with developing Developing high frequency balance and gait training program has shown to elicit improvements in both static and dynamic balance and reduce risk of falls. So the balance training is really crucial in reducing the risk or the occurrence of falls. So here we have a quick little chart that I got from I believe this is multiple sclerosis, one of those websites. It breaks it down into resistance training, aerobic training, and cuts down. It tells you the duration and frequency, and also the methods as to which you can do these things. So stationary recumbent bike, cycling, stepping, just low level aerobic activities to improve our overall aerobic capacity. The duration is usually 30 minutes a day. You could break them down to 3 10-minute bouts depending on your condition that day, your level of fatigue, lassitude. The frequency is usually 3 to 5 sessions per week, and that is variable too, depending on how you're presenting that week, because each week is highly fluctuating or different from one another. And then when it comes to resistance training, so big thing about resistance training is that we have to work with what we have, and spasticity might limit our capacity to perform certain tasks, but we can always work around that. You ideally want to utilize uh, machines that or address the agonist and antagonist of some kind of movement to keep that well balanced, like synergy between the two. Uh, you want to keep the exercise modalities as variable as possible. So 8 to 10 exercises emphasizing both upper and lower major muscle groups. Work on balance, the agonist and antagonist muscle groups. Place special emphasis on the posterior shoulder girdle, hip, spine, knee extensors, dorsiflexor muscles. Again, for those walking parameters to improve our walking capacity. And here's some examples of exercises that correlate to strength training: lat pull downs, seated scap rows, shoulder press, chest press, seated leg press, knee extensions, hamstrings. Just again, uh, addressing the agonists and antagonists in both major muscle groups, both upper and lower. The intensity is usually a little higher, 8 to 15 reps, 60 to 80% of your 1 rep max. And again, your physical therapist can help you uh, develop this program, and based off of your initial testing and assessments, kind of gauge where you want to steer most of your focus towards.
So when it comes to diet, what are some foods that we should be consuming? What are some foods that we maybe should want to avoid in regards to the progression of MS? So recent evidence shows that there's a relationship or association between having high levels of LDL cholesterol, which is that bad cholesterol. Again, we have LDL and we have HDL. LDL is considered that bad cholesterol. HDL is considered that good cholesterol. So there has been a relationship between having too much LDL and poor outcomes with the management and progression of MS. So a recent study published in a journal showed that women who consumed whole milk 3 or more times a day had almost a 50% increased risk of developing MS compared to those who consume less than 1 serving per day. So there has been an association between milk and MS. Does have a specific molecule that triggers an immune response in the body. And as we know, MS is an autoimmune disease in which our body pretty much attacks our own cells because it gets confused. So just limiting, whole milk consumption is going to help decrease some of the progression of MS. So when it comes to LDL, we want to avoid certain foods that have a lot of LDL, such as like fast food, foods that are high in fats, saturated fats, trans fats, and we want to incorporate more foods that are high in HDLs, good cholesterol, such as like avocados, oatmeal, things like that. So vitamin D. There has been an association between vitamin D and multiple sclerosis. So it's good to keep our vitamin D levels high because it's going to help decrease any kinds of flare ups that we may experience. I'm sure you guys have experienced flare ups before. They're not fun. They can be really debilitating at times. So keeping our vitamin D levels at normal level is very important. And certain foods that contain vitamin D are going to be cod liver oil, even just 1 tablespoon of it. certain fish like salmon, trout, and vegetables such as mushrooms, whether they're white, raw, or sliced, can elevate our vitamin D levels. So, vitamin D and relapses or flare ups. There was a study done in the Netherlands that evaluated um, 73 patients that had relapsing remitting MS. So, out of these 73 patients, vitamin D levels were measured every 8 weeks. And 58 patients experienced a total of about 140 flare ups during the time period or during the study. So, flare ups were significantly reduced in those who had medium and high blood levels of vitamin D compared to those with low levels. So, for each doubling of vitamin D concentration, MS relapse risk decreased by almost 30%. So, what this study showed essentially is that when our vitamin D levels are normal and when they're not too low, we can have reduced amounts of flare ups by almost 30%.
So, exacerbations and pseudo exacerbations, not all flare ups lead to more damage to your body. Exacerbations are new symptoms or worsening of older symptoms lasting more than 24 hours without alternate explanation. They, and with a preceding period of clinical stability lasting at least 30 days. So, what this is saying that a flare up won't have any preceding symptoms or signs that might give you information as to when they're going to come on. They're usually they're usually following periods of remission, so you won't really necessarily understand why or when they're going to come on. They're just very spontaneous. Fluctuations in your symptoms or worsening of symptoms with fever, heat, or infection are not considered true exacerbations unless they meet the above criteria. They are often referred to as pseudo exacerbations. So, again, these pseudo exacerbations are going to have some warning signs, fevers, low levels of energy, things like that, telling you that something's wrong, but not necessarily a real flare up. So there's not actually damage to the nervous system occurring just yet. Uh, and if it's a true exacerbation, contact your doctor for evaluation, which will most likely require steroid treatment to suppress that immune response. Identifying triggers. So, triggers is a big thing that you want to look out for. You want to keep a log and see what is causing these flare ups or pseudo flare ups. Stress is something we all have to deal with. Lack of sleep is something that I feel everyone goes through at one point in their life. Fatigue, infections such as UTIs, heat. You want to stay in a well regulated room that's temperature controlled, especially when you're doing these physical activities, to not exacerbate any more pseudo flare ups or symptoms. Certain medications, so be aware of the side effects of the medications you're taking and being stringent with your medication routine. So, not taking your medication might actually, or will in most cases, lead to increase in these triggers or these pseudo exacerbations.
So, as Manny said, stress is a trigger for flare ups, whether they're true flare ups or pseudo flare ups or exacerbations. It's something that we need to identify as a trigger and manage our stress appropriately. So, what can we do to help manage our stress? Well, we can perform a certain type of meditation, very simple. So, I want everybody to get in a nice, comfortable position, whether that's seated, whether that's, with your eyes, well, whether it's seated or laying down. In this case, we're going to be doing it seated. We're all going to take 15 slow, deep breaths through our nose with our eyes closed. So you breathe in through your nose, out through your mouth. That's 3. We're going to go to 15. Okay, let's say we did 15. So now what we're going to do is I want everyone to choose a positive word that represents something to you, such as, something positive to you, such as it could be grace, peace, freedom, gentleness, self-control, courage. Choose a word and stick to it every single time you do this exercise. Do not change it. Now, in a calm and effortless way, repeat this word in your mind with your eyes closed without making any sounds or moving your lips or tongue for 10 minutes. And have your eyes closed. So as you breathe in, say the word in your head, and as you breathe out, just breathe out through your mouth. Now you can open your eyes. We're going to close our eyes again and take 15 slow, deep breaths through your nose and out through your mouth. This time we're not repeating the word.
All right, so this is a take-home pamphlet that's available to all you guys. It's kind of reiterating some of the stuff that we went over today. So understanding your MS, what it is, what type of exercise you should do, just general recommendations. I would definitely say go over these with your physical therapist or doctor, trainer, whoever you have helping you with your functional deficits, seeing what's right for you. Diet recommendations. Again, we are not licensed professionals, so please consult your doctor when it comes to nutritional advice. These are just some recommendations for some high vitamin D foods. Supplements again, consult your doctor. But vitamin D, B, and A have been shown to limit the chances of exacerbations or the extent of how bad these exacerbations are. There is no definite studies or there's no conclusive studies, but there have been a lot of case studies that show the benefits in taking these three vitamins. Identifying your triggers, like I said before, stress, lack of sleep, fatigue, infection, heat, certain medications, and not taking your medications. And below is a link that you can find support to kind of chat with others that are going through similar things that you guys are, and just know that you're not alone when it comes to overcoming this, all the hurdles that this thing throws at you.
Thank you guys. Really appreciate your time. We'll stick around if you have any questions for us. Thank you.